Welcome back to another video of Reflection with PCUA. The topic for this video is contraceptive methods. Many elements need to be considered by women and men or couples at any given point in their lifetimes when choosing the most appropriate contraceptive method. In choosing a method of contraception, dual protection from the simultaneous risk for HIV and other STIs also should be considered. Although hormonal contraceptives and IUDs are highly effective at preventing pregnancy, they do not protect against STDs, including HIV. First, there are the reversible methods of birth control, intrauterine contraception. This IUD is a small device that is shaped in the form of a T. It can stay in your uterus for up to 10 years. Levonorgestrel intrauterine system. DLNG IUD is a small T-shaped device like the copper T IUD. It releases a small amount of progestin each day to keep you from getting pregnant. It can stay in your uterus for up to 3 to 6 years. Hormonal methods. Implant. The implant is a single thin rod that is inserted under the skin of a woman's upper arm. The rod contains a progestin that is released into the body over 3 years. Injection or shot. Women get shots of the hormone progestin in the buttocks or arm every 3 months from the doctor. Combined oral contraceptives, also called the pill. Combined oral contraceptives contain the hormones estrogen and progestin. A pill is taken at the same time each day. Progestin-only pill. Unlike the combined pill, the progestin-only pill, sometimes called the mini pill, only has one hormone, which is progestin, instead of both estrogen and progestin. Patch. This skin patch is worn on the lower abdomen, buttocks, or upper body, but not on the breasts. It releases hormones progestin and estrogen into the bloodstream. You put a new patch once a week for 3 weeks. Hormonal vaginal contraceptive ring. The ring releases the hormones progestin and estrogen. You place the ring inside your vagina. You wear the ring for 3 weeks, take it out for the week you have your period, and then put in a new ring. The barrier methods are diaphragm or cervical cup. Each of these barrier methods are placed inside the vagina to cover the cervix to block sperm. The cervical cup is a thimble-shaped cup. Before sexual intercourse, you insert them with a spermicide to block or kill sperm. Sponge. The contraceptive sponge contains spermicide and is placed in the vagina where it fits over the cervix. The sponge works for up to 24 hours and must be left in the vagina for at least 6 hours after the last act of intercourse. Male condom, worn by men. A male condom keeps sperm from getting into a woman's body. Latex condoms, the most common type, helps prevent pregnancy and HIV and other STDs, as do the newer synthetic condoms. Natural or lambskin condoms also helps prevent pregnancy, but may not provide protection against STDs, including HIV. Female condom, worn by the woman. The female condom helps to keep sperm from getting into your body. It can be inserted up to 6 hours before sexual intercourse. Spermicides. These products work by killing sperm. They are placed in the vagina no more than 1 hour before intercourse. You leave them in place at least 6 to 8 hours after intercourse. You can use a spermicide in addition to a male condom, diaphragm, or cervical cup. Emergency contraception. Emergency contraception is not a regular method of birth control. Emergency contraception can be used after no birth control was used during sex, or if the birth control method failed, such as if a condom broke. In this case, women can have the copper T IUD inserted within 5 days of unprotected sex, or women can take emergency contraceptive pills up to 5 days after unprotected sex but the sooner the pills are taken, the better they will work. And finally, there are the permanent methods of birth control. Female sterilization. A woman can have her fallopian tubes tied or closed so that sperm and eggs cannot meet for fertilization. The procedure can be done in a hospital or in an outpatient surgical center. You can go home the same day of the surgery and resume your normal activities within a few days. Male sterilization or vasectomy. This operation is done to keep a man's sperm from going to his penis, so his ejaculate never has any sperm in it that can fertilize an egg. The procedure is typically done at an outpatient surgical center. The man can go home the same day. Recovery time is less than 1 week. After the operation, a man visits his doctor for tests to count his sperm and to make sure the sperm count has dropped to zero. This takes about 12 weeks. With this, I finished this topic. I hope you guys find the information useful. So, I'll see you next time.